Children can take ill and deteriorate quickly. This is why it's important to have equipment that allows you to get children requiring respiratory support onto the prescribed therapy quickly. Bronchiolitis is a common infection affecting the lungs of babies and very young children. It is usually caused by a virus called the Respiratory Syncytial Virus, RSV. It can make them wheezy and affect their breathing. The management of bronchiolitis depends on the severity of the illness. In most babies and children, bronchiolitis can be managed at home by parents or carers, but some children need hospital care. How many cases of bronchiolitis do you see in your ward each year? High-flow oxygen therapy and CPAP are some of the recommended respiratory support therapies for the treatment of bronchiolitis and hypoxemic respiratory failure. AquaVENT FD140i helps facilitate a quick escalation from high-flow oxygen therapy to CPAP if required, reducing the need to stock two devices and reducing the time and work involved in switching between therapies. High-flow oxygen therapy has been shown to lower rates of escalation of care due to treatment failure than standard oxygen therapy. High-flow oxygen therapy was shown to decrease the work of breathing, improve oxygenation, and reduce rates of intubation in infants with bronchiolitis. NICE guidelines recommend oxygen supplementation for children over 6 weeks if their oxygen saturation is persistently less than 90%, or less than 92% in babies under 6 weeks. CPAP is to be considered in babies and children with bronchiolitis who have impending respiratory failure. The control provided by AquaVENT FD140i helps to provide the optimum care for your patients. Single increment control of flow range 2 to 70 litres per minute. Oxygen range is 21 to 100%. Nebulizer function is available alongside the prescribed respiratory therapy or on its own. CPAP may be considered for patients that require escalation or have not responded to high-flow oxygen therapy, or those who have signs of impending respiratory failure with symptoms such as listlessness or decreased respiratory effort, recurrent apnea, or inability to maintain adequate oxygen saturations despite supplemental oxygen. As a child's condition can rapidly change, it is important to have equipment and circuitry that allows you to monitor the patient closely and easily transition between CPAP and high-flow oxygen therapy as required. Our AquaVENT gas flow driver and associated circuitry are designed with paediatric wards in mind. The user-friendly interface, streamlined design, and signature purple colour make it an attractive and easy-to-use option for healthcare providers. Contact us to learn more about how the AquaVENT FD140i can assist with respiratory support for young patients in your paediatric ward.